What's going on, folks? Welcome to the Dr. Kamal Jones Show. I am Dr. Kamal Jones. It is absolutely fantastic to be here with you. The Dr. Kamal Jones Show is our newest podcast. It's focused on all things at the intersection of health and politics, because we need to know what is going on behind the scenes with the systems that influence our health and our well-being. We're so excited to be with you and to shine light on issues that really matter across the intersection of health and politics. So welcome to the Dr. Kamal Jones Show. So listen, I want to jump right into it with our first episode of this show. I want to talk specifically about Elon Musk becoming the world's first trillionaire and why that matters for our health, the impact, the connection it has with our healthcare and our health systems, and what it says about our society at large. So the other day I posted a short reaction video talking about Elon Musk becoming the first trillionaire and really putting it into context with the things that I see on the other side of such enormous wealth in our society, which are children who are struggling just to have food on the table, families that are struggling with housing, and Elon as really being someone who pushed forward some major cuts in the health and well-being resources that exist for people, not just here in the United States, but really all over the world. So check out that short video when you get a moment. Now, the response to the video is actually what prompted me to say, all right, let's go ahead and do our first episode of the Dr. Kamal Jones Show, because there were a lot of mixed feelings about it. For some people, they were super supportive, right? They saw some of the issues that exist within our systems. They remember, because it was only a year ago, some of the cuts that Elon Musk led as he spearheaded the Department of Government Efficiency. On the other side, there were a number of people who felt like people should just be able to be successful. It's America. What does one thing, someone being successful, have anything to do with your patients having difficulties or struggling to make ends meet? And we'll talk about that. And there were some people who just didn't know how to respond, and so did the very classic diversions that people tend to do when they are overwhelmed by information that does not fit their mold or understanding of what life should be. Nonetheless, I found all of these engagements to be really interesting, because it was clear that there is a discussion to be had about this. And so what I want to break down in this episode is really about why Elon becoming the world's first trillionaire is really illustrating some of the big issues that we have in our society, specifically as it relates to our health and our well-being. And there are a couple of sort of angles that I want to focus on. The first thing I want to break down is why Elon Musk in particular, why his becoming the world's first trillionaire is almost a slap in the face to the individuals who have been impacted by the decisions that he has made within our United States government. The irony of Elon Musk being the first person to become a trillionaire in this world, while simultaneously being responsible for the deaths already of hundreds of thousands of people from government cuts, is one that hopefully does not get missed on any of us. Elon Musk, while he was leading the Department of Government Efficiency, cut 90% of the grants in the budget from USAID. That's the United States Agency for International Development. Ultimately, USAID was essentially shut down, folded into the Department of State. The cuts that Elon led have already led to hundreds of thousands of deaths across the world. These were cuts to food resources. These were cuts to medications, such as HIV medications. These budget cuts have led to hundreds of thousands of deaths. It is projected that by 2030, there will be 14 million dead individuals across the world as a direct result of the cuts that Elon Musk made. Here in the United States, we know that Elon Musk, under that Doge department, went ahead and led millions of dollars of cuts in NIH funding, millions of dollars of grants that should be going to finding cures for childhood cancer or closing gaps in rural healthcare or finding treatments for Alzheimer's have been cut directly at the hands of Elon Musk. He decided that those things were not valuable enough and deserved to be cut. And as a result, people have lost their lives and will continue to do so. And keep in mind, this was all in the name of quote unquote government efficiency. The same government that is building UFC fighting matches on the front lawn and is decorating gold ballrooms and asking Congress for $1 billion to do that. The same government that attempted to take $1.8 billion out of taxpayer hands to give to Trump supporters is the same government that cut billions of dollars out of USAID and has cost the lives of hundreds of thousands and projected to be 14 million people by 2030. And this, again, was under the leadership of Elon Musk. And so when we talk about the impact of this person being the first trillionaire while simultaneously dooming millions of people to their demise, the poorest people around the world, that is an irony that can't be missed. So yes, I have a problem with it. It is a problem that we need to be able to wrestle with as a country. The second thing I want to break down is some of the system level issues that lead to this kind of gross accumulation of wealth while simultaneously being a country in which millions of people are struggling just to make ends meet and to have the basic necessities of life. You know, I talked in the short video that I posted before about a patient of mine whose family was concerned about them having even a minor bruise or rough housing with their sibling because if they ended up in the emergency room, it was going to potentially bankrupt the family. I talked about a family who struggled just to have any food on the table for that child because of the struggling economy that we have in our country. Listen, I am happy for people to be successful. This isn't a knock on someone's success. I'm a doctor, right? Obviously, I've been blessed to be able to care for my family. I've plenty of friends who have been very fortunate to make great money, to be able to do a lot of interesting things, and to be able to care for their families. That's not what we're talking about. It is about system level issues that create a wide gap between those who have seemingly unlimited amounts of money and those who are struggling just to have basic goods, including things like healthcare. What we're seeing with Elon Musk, when we see the world's first trillionaire in a time of record levels of income inequality, in a time in which AI is literally kicking millions of people out of the workforce, in a time in which people are struggling with healthcare and medical related debts, in a time when Medicaid is being cut across the country, in a time when SNAP benefits are being cut across the country, decreasing access to food, in a time when a president is launching billion-dollar-a-day wars, in a time when all this is happening, America also gets its first trillionaire. These things are not unrelated. For example, we don't have the resources to fund a Medicare for all system, the level of tax base that is required, in part because those who are most responsible, if you will, for actually funding that tax base are also the ones who are writing the tax code, because the wealthy folks in our country are the ones who are paying for lobbyists, who are paying for politicians' elections, who are directly handling the writing of our tax laws. And we know that because we saw it with the so-called One Big Beautiful Bill Act, which was the largest transfer of wealth in the history of the United States from those who have the least to those who are the wealthiest. On the backs of things like Medicaid cuts and SNAP cuts, tax breaks were extended disproportionately for the wealthy. Elon Musk does not become a trillionaire if America has an appropriate progressive tax system. It's not just about taxation. It's about creating a system in which wealth flows more equitably. We struggle to create systems of universal health access, insurance systems like a single payer system or Medicare for all system. We struggle to have enough physicians in rural areas of our country. We struggle to have access to medications at a reasonable cost. These things are not divorced from the fact that Elon, as an example, but many others as well, are able to hoard a tremendous amount of resources, shield their money from taxation through legal means. Legal because they are funding the writing of the laws, and those who are actually building the companies, the workforce of these companies, often can't even afford to live in the very communities that their company is based in. We will not achieve the level of healthcare and well-being that we have a right to as human beings on this planet until we challenge the system of such vast wealth inequality. We have to. There is no other path forward. So how do we do that? Part of the way we have to move forward is by calling politicians to task who are taking this dark money and endless amounts of funding from the rich. And we have to put people into place who are going to push forward with getting money out of politics. We have to overturn Citizens United and do what it takes to extract money from being the main method of communication when it comes to politicians in this country. Until we do that, we are going to see more and more billionaires and trillionaires, while more and more people continue to struggle to even buy that first house or to put food on their table or to get access to healthcare. As we enter the midterm elections, these are the kind of things that we have to think about, that we have to put at the forefront of our decision-making process. Who is pushing forward with business as usual, looking to propel corporate greed and wealth consolidation? And who's showing up to do the hard work of actually building a society with some equity, where people can be successful, make their millions, do whatever they want to do, but everyone has access to healthcare. Everyone has a warm plate of food to eat, has access to housing, has access to life, to liberty, to the pursuit of happiness, not just those who have the most money. All right, my friends, that is our episode today. I am just over the moon, so ecstatic to be with you here on the Dr. Kamal Jones Show. We will catch you every Wednesday. So make sure you don't miss an episode. Like the episode, subscribe to the channel, follow us on Spotify or wherever you listen to podcasts. And we are so excited to be engaged with you. We're available on YouTube. Tune in with us, and we'll catch you next week, Wednesday. Peace.